Welcome to our quarterly Employee Awards and Recognition Ceremony. We are here to recognize our team of dedicated employees for their contributions to serving our nation's heroes. My name is Ruth Hatchwell. I'm the Veteran Experience Program Manager here in the Employee and Patient Experience Service Department. Our department is designed to enhance our employee and veteran experience and to ensure that we continue providing world-class care to our veterans throughout Northeast Ohio. I would like to welcome our awardees, in addition, our executive leaders, as well as the managers, supervisors, and service chiefs who have come to honor, recognize, and support our awardees. Following the ceremony, we have a reception in the back of the rec hall, so we hope that you'll all stay to enjoy that. Please welcome our Acting Medical Center Director, Dr. Tim Hyman, to provide opening remarks.
Good morning, everyone. Welcome. Great crowd. Thank you for coming on this blistering 90-degree day in Cleveland, Ohio. We do lots of things right within our healthcare system, and about a month ago, you all had Joint Commission. I was actually not here for that, so I thank you for holding down the fort when some of us were gone, but that's what we do well. So, we are able to represent and recognize a handful of folks today, but I bring up Joint Commission and many other things because of how wonderful all of our employees do. We have lots of things that aren't being recognized today. We do a great job recognizing the various things we can, but I think everyone deserves recognition for how wonderful of a healthcare system we have. Joint Commission just continued to double down on that. I think I overheard Jill when I came back giving me some brief overviews of things I missed, and she referenced it was one of the best Joint Commissions that she's ever been through, and that's a kudos to everyone, not just the folks that are receiving awards today. So congrats to the award winners, but again, congrats and thank you for all of our staff for everything that they do for veterans, and you all deserve your recognition like some of the folks are getting today. So thanks.
Thank you, Dr. Hyman. Good morning. My name is Catherine Bird. I'm an education instructor in the Employee Patient Experience Service. I would like to welcome you all here today, especially our awardees. This is an exciting moment for you and a proud moment for us. It is my honor and pleasure to be your mistress of ceremonies today. We will now begin presenting our first awards, starting with the Length of Service Award. VA Northeast Ohio Healthcare System appreciates its employees. Employees make VA not just a job, but a career. It is essential that the VA has experienced and knowledgeable employees to support the mission of the VA. VA Northeast Ohio Healthcare System acknowledges employees with service awards based upon the years of service that an employee has worked at the VA to demonstrate its appreciation for these employees. I am privileged to call up these employees to receive their Length of Service Awards. Please hold your applause until the employee in the service group listed have been announced. Dr. Hyman will present the following awards from the Director's Office. 20 years, Robert Thompson. Thank you, Dr. Hyman. Mr. Andy Pacina will now honor these awardees from Engineering, Facilities Management, Informatics, and Analytics. 45 years, Anthony Lely, Engineering. 35 years, Connie Calhoun, Health Informatics. James Cosman, Facilities Management. 25 years, Scott Kissinger, Fiscal Services. 20 years, Troy Cohen, Facilities Management. Dr. David Massaro, Chief of Staff, please join us at the podium to honor these awardees from Audiology and Speech, Diagnostic Imaging, Medicine, Neurology, PM and RS, Primary Care, Psychology, Psychiatry, Research, Social Work, Specialty Care, Spinal Cord Injury, and Surgical Care. 45 years, Edward Burney, Surgical Care. 35 years, Gina Mazzeo, Diagnostic Imaging. Neil Peachy, Research. David Stepnick, Surgical Care. 30 years, Dale Jerome, Neurology. Joyce Wembley, Psychology. 25 years, Michelle Davidson, primary care. Patrick Hopperton, primary care. Ronald Reachers, neurology. Gregory Wright, diagnostic imaging. Anuradha Yalamanchili, primary care. 20 years, Cheryl Delacki, surgical care. Ali Kasey, diagnostic imaging. Bob Lafferty, spinal cord injury. Daniel Maxwell, surgical care. Leah Miller, audiology and speech. Michelle Nolan, PM and RS. Pei-Jun Chen, psychiatry. Patricia Schmidt, diagnostic imaging. Mark Smith, social work. Diane Waite, social work. Tatiana Wassel, specialty care. Sarah Wolf, social work. Dr. Hyman, acting director, will present these awards from the outpatient clinics and pharmacy. 35 years, Jeffrey Garcia Sr., COPS. 30 years, Harold Hightower, COPS. Daryl Russ, pharmacy. "25 years, Brian Dennison, COPS. Mary Heigl, COPS. Gregory Wright, COPS. 20 years, Travis Armstrong, COPS. Danielle Cooney, pharmacy. Jessica Ellis, COPS. Carl Franzik, COPS. Oh, I apologize. Okay. All right. That's okay. It's Jessica? Jessica Ellis, COPS. Carl Franzik, COPS. Gregory Horn, pharmacy. John McNeely, COPS. Cynthia Newton, COPS. Angel Ortiz, COPS. We will now honor these awardees from Environmental Management Service, Police, and Security Services. 25 years, Robert Heron, Environmental Management Service. 20 years, Anthony Nolan, Environmental Management Service. Michael White, Environmental Management Service. Jesse Arnn, Police and Security Services. Ms. Katina Stone-Jones, Associate Director, please join us at the podium to honor these awardees from Logistics, Supply Chain Management, Matrix Services, Nutrition and Food Service, Patient Care Administration Service, and Prosthetics and Sensory Aids. 40 years, Larry Foote, PCAS. 35 years, David Bond, VCS. 'Cindy Fort, PCAS. Diana Rock Shively, PCAS. 30 years, Lori Paulin, Nutrition and Food Services. 25 years, Barbara Washington, Supply Chain Management. 20 years, Daryl Johnson, Logistics. Verna Jones, PCAS. Anila Joseph, PCAS. Michelle Kime, PCAS. Robert Means, Prosthetics and Sensory Aids. Thank you, Ms. Stone-Jones. Mr. Garrett Schreier, Associate Director, Patient Care Services. Please join us at the podium to honor these awardees from Nursing Mental Health, Nursing Education and Learning Resources, Nursing GEC, and Recreation Therapy. 45 years, Katrina Brown, Nursing Mental Health. 30 years, Michael Bates, Nursing GEC. 25 years, Ronald Sims, Nursing GEC. Lisa Weber, Nursing Education and Learning Resources. 20 years, Christine Hallenstein, Nursing Mental Health. Kelly Kuntz, Nursing Mental Health. Darlene Zabinovic, Recreation Therapy. Thank you, Mr. Schreier. Let's give our Length of Service awardees a round of applause. This quarter, we have a special award, the CFC Cheerleader Award. Once again, we have an employee who has received the CFC Cheerleader Awards for the Ohio Combined Federal Campaign Award. Ariel McNutt is being recognized with the CFC Cheerleader Award for her exceptional efforts in the 2023-2024 Combined Federal Campaign. In a difficult fundraising year, full of challenges, both internal and external, Ariel led the effort with creativity and passion, coming up with new and novel ways to not only promote CFC, but to engage employees across the organization and beyond. Her ideas impacted not only VA Northeast Ohio healthcare system, but the entire Midwest region. This award was identified specifically for this outstanding employee by the CFC leadership at the national level, and we are fortunate to have her on our team here. Please congratulate Ms. Ariel McNutt, who co-coordinated the 2023-2024 campaign at VA Northeast Ohio Healthcare System. It is now time to congratulate the award recipients of the following awards: Daisy Nurse Award, Sunshine Award, Secretary Award for Nursing Excellence, Great Catch Awards, Employee of the Month, Eye Care Individual Awards, Eye Care Award for Serving Leadership. Mr. Garrett Schreier, please join us again at the podium to present the Daisy Nurse and Sunshine Awards. The Daisy Nurse Award. The Daisy Nurse Award is an international award that recognizes the superhuman work nurses do for patients and families every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. Their exceptional and compassionate care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All VA Northeast Ohio Healthcare System RNs and LPNs are eligible for this award.
Thank you. Good morning. So for our Daisy Award, the first time I met Ms. Strozer, she was warm, friendly, and inviting, and treated me as a valued customer, providing great customer service. As the ALS coordinator, I periodically visit the inpatient unit and sometimes need assistance with processes and policies for inpatient, as I am more familiar with outpatient. Ms. Strozer always has a ray of light about her. She exemplifies exceptional customer service and embodies the I care values of the VA. As the ALS coordinator, occasionally visiting the inpatient unit, I have always found her to be welcoming and knowledgeable about inpatient processes and policies. A veteran with ALS who frequently inquired about a nurse he admired during his outpatient visits was profoundly impacted by her care. The nurse turned out to be Asia Strozer. Her compassion and support for his autonomy made him feel well cared for despite the rapid progression of his disease, illustrating the importance of time well spent with patients. In a recent interaction, her courteousness and patient assistance over the phone regarding respiratory therapy procedures further highlighted her exemplary professional conduct. Asia consistently rises above the workload demands, showcasing her dedication and positive spirit, thus making a significant difference in the lives of those she serves. She truly shines in her role. Please congratulate Asia Strozer, RN 6B.
The Sunshine Award. The Sunshine Award is a recognition program unique to VA Northeast Ohio Healthcare System. It helps recognize our outstanding nursing assistants, surgical, and healthcare technicians who support VA nurses in caring for our nation's veterans. Nursing support staff are a vital part of the healthcare team. They partner with the RN and LPN to provide direct care for patients of all backgrounds. Patients and families often share stories about how these employees provide exceptional care and help create a safe, comfortable, healing environment. Sunshine Award stands for smiling, understanding, and nurturing while sharing a helping hand in nursing excellence. The Sunshine Award offers a way to recognize these individuals for the remarkable care they deliver. All VA Northeast Ohio Healthcare System nursing assistants, surgical, and healthcare technicians are eligible for this award.
All right. I think as I read through this, you will see that that acronym was very appropriate for Sunshine. This nomination was submitted by a veteran. The Cleveland VA is fortunate to have Lisa and the vets she helps. I came to the CARES Tower third floor with leukemia and unable to walk. I was in pain and depressed. Lisa has a positive attitude anytime she was on duty. She encouraged me that I would be okay, and I would walk again. She comforted me about the sudden loss of my girlfriend as well. Lisa showered me, took care of my hygiene. She made sure to include me on VA activities outside of the third floor. In August, I was declared in remission, but physical and occupational therapy did not have an easy time with my walking. When I came to CARES Tower, I was ready to give up, but Lisa would not let me. Today, I'm walking on my own and expect to be going home next week. I'm grateful to Lisa, and others at the Cleveland VA. Please congratulate Lisa Rowe, nursing assistant.
Mr. Garrett Schreier will present the Secretary Award for Nursing Excellence. The VA Secretary Awards and Nursing Excellence Program, established in 1984, annually honors one medical center nurse executive, registered nurse in a staff nurse role, and one in a non-staff nurse role, i.e. advanced practice nurse, nurse manager, instructor, a licensed practical nurse, licensed vocational nurse, and a nursing assistant actively engaged in the care of patients at the VA Medical Center. The recipient's contributions to the care of patients in any VA healthcare setting are patient-driven and demonstrate such excellence as to merit recognition from peers. This award is given only once to an individual.
All right, Secretary's Award for Nursing Excellence, RN Expanded Role. Ms. Blake is the Home Oxygen Program Manager Coordinator, overseeing the contracted oxygen vendor and home oxygen needs within the VA Northeast Ohio healthcare system. She manages the daily operations of the home oxygen staff and clinics, indirectly supervises respiratory therapists and ancillary staff, is the only registered nurse in Vision 10 in her role. She brings her nursing knowledge and understanding to the forefront when handling patient concerns and needs and when educating the home oxygen staff. Ms. Blake played a crucial role in training 4 new respiratory therapists and uses her nursing expertise to address patient concerns and educate staff. She upholds VA Directive 1173 and actively educates staff and veterans about the directive to ensure preparedness for home oxygen assessments. She updated the home oxygen note and prosthetics consult in the electronic medical record, making them clear and user-friendly, aligning with VISN requirements. Her focus on increased safety and clear processes has led to significant improvements. Under her leadership, the program expanded from 1 clinic and 3 respiratory therapists to 5 clinics and 5 full-time equivalent respiratory therapists, plus 1 hybrid RT. Ms. Blake has spearheaded collaborations with the pulmonary department to enhance access for veterans throughout the Northeast Ohio healthcare system. Please congratulate Crystal Blake, RN, Home Oxygen Coordinator, VA Northeast Ohio Healthcare System. All right, next, registered nurse staff role. Ron Dixon is an exemplary nurse who consistently demonstrates expert practice in caring for the homeless veteran community and supporting the team. He prioritizes patient care and advocates for veterans to ensure they receive the necessary services. Ron takes time to assess veterans' needs, explains things clearly to them, and goes above and beyond in his daily duties. He precepts and educates other nurses, supports staff shortages within the homeless program, and maintains high-quality documentation that informs providers and multidisciplinary team members of veterans' needs. Ron leverages resources to support the homeless program office mission to end veteran homelessness, assists in housing veterans, and provides intense case management to help maintaining their housing. Ron is well-versed in community resources and utilizes this knowledge to support veterans, especially during challenging times, helping them access necessary resources. His dedication and expertise significantly contributes to the well-being and stability of homeless veterans. Please welcome Ron Dickinson, RN, CRRC.
Real quick, I'm going to stop the program for 1 second. There's one more secretary award. He did hear one nursing exec receives this award every year, and that nursing exec came up with the receive it from him. So I told him I would call him out. Garrett Schreier was the name of the no fiction.
Thank you, Dr. Hyman. We will now present the Great Catch Awards for Quarter 3, 2025. Patient safety reporting is important to improving patient care, decreasing adverse events, promoting awareness of possible adverse events, and becoming a high reliability organization. Great Catch Awards are a patient safety continuous improvement initiative to encourage staff to recognize and prevent adverse events. This quarter, we recognize a few employees who received the Great Catch Awards between April and June 2025. Please welcome Ms. Dolly Edmond, Patient Safety Manager, who will present these awards. We would like to congratulate and recognize the following employees for their great catches.
Good morning. For April, a wonderful example of dedication occurred when Patient Care Coordinator Allison, I apologize if I don't get this right, Chahada, noticed that after a veteran had a surgical procedure with a known cancer, a pathology report had posted a newly found cancer diagnosis. No alert from pathology was received. The pathology report was extremely long and included multiple sections. Therefore, if the provider is not alerted to the new diagnosis, this could be overlooked when renewed, delaying veteran care. This issue was brought to the attention of the surgeon, pathologist, and sections chief. Please congratulate Allison, RN Patient Care Coordinator, Urology Department. For May, on the evening of April 21st, Tom was the solo RN working in bed control during a busy shift. A patient, Mr. H, was diagnosed with acute kidney injury related to hyperglycemia and right lower lobe pneumonia. Initially, Mr. H's lactate levels were elevated at 2.5 and increased to 4.8 after receiving IV fluids in the ED. While preparing for transport to the floor, Tom noticed that a third repeat lactate test had not been done after the administration of the second liter of fluids. Tom alerted the team, and the repeat lactate was nearly 5, prompting a reevaluation and moving the patient to ICU instead of the floor. Mr. H ultimately developed cardiogenic shock overnight, requiring advanced therapies. Tom's clinical judgment ensured the patient received the appropriate level of care from the start. His vigilance and collaboration exemplify dedication to providing the best care for our patients. Please congratulate Tom Slusala, Registered Nurse Case Management. For June, a patient checked in for an appointment in general surgery. His vital signs were taken. Patient's weight was recorded incorrectly. Based on the historical data, it appears that the value in pounds was recorded as kilograms. And the patient is also seen by hematology oncology and was scheduled for chemotherapy the next day. Using the recorded weight data would have resulted in nearly a 50% overdose of his chemotherapy drugs. Errant weight was noticed by pharmacy during the chemotherapy double check process. Previous weight was used for the dose calculations. Please congratulate Dave Panning, clinical pharmacist.
Thank you, Ms. Edmond. Our Employee of the Month Awards. VA Northeast Ohio Healthcare System strives to recognize individual employees who make contributions in support of the mission, organizational goals and objectives, and VA's strategic plan. This monthly award recognizes outstanding employee efforts during the specified period as evidenced by peers, customers, and management. The employees that are chosen for this award are nominated by other VA employees. A committee reviews the nominations and selects the awardee. The next awardee has received an Employee of the Month award between April through June 2025. Please welcome Ms. Ruth Hatchwell from the Employee of the Month Committee to present these awards.
For April 2025, Nadal is a registered nurse in the PACU. While recovering a veteran following a urological procedure, he determined that the patient's blood glucose was elevated. Mr. Ashreem interviewed the patient and discovered that the patient's blood glucose had been elevated pre-procedure because his daily insulin dose was held due to his NPO status for the procedure. Mr. Ashreem spoke to the anesthesia team to address his blood glucose in the PACU. Nadal also raised concerns as he was afraid that the patient's discharge plan was to go home. Upon consultation with the surgical team and the anesthesia team, the recommendation was for the veteran to stay the night to be monitored. When speaking to the veteran and his daughter, it was determined that although the veteran was on a daily insulin regimen prescribed outside of the VA, the veteran did not have a blood glucose monitor. The veteran was adamant about being discharged home. Being a patient advocate, Mr. Ashreem was able to work with the care team. He ran down to primary care and secured the necessary items for home monitoring and provided education to the veteran and his family. Nadal is always a patient advocate, but in this instance he went above and beyond to work with the veteran to have a discharge plan that was safe for the veteran. Please congratulate Nadal Ashreem, registered nurse in the PACU. Our May winner. A veteran lost his Med-L cochlear implant during an inpatient stay. After being discharged home, which was 2 hours away, the bed-bound veteran needed a replacement. Ms. Rachel Cleary, an audiologist, arranged necessary programming and training with a Med-L representative. She set up a January 2025 appointment involving the veteran, his daughter, and the representative. However, the family could not afford transportation, and VA travel services couldn't assist due to the veteran traveling on a gurney. Ms. Cleary coordinated with the representative to program the cochlear implant at Wade Park and mailed it to the veteran. A virtual appointment was completed on February 11, 2025. The veteran's daughter reported improved hearing and active engagement in conversation. Ms. Cleary provided her direct contact number for future needs, demonstrating her dedication to enhancing the veteran's quality of life by ensuring effective use of this cochlear implant. Please congratulate Rachel Cleary, audiologist.
Our next awards will be the iCare Awards. iCare Individual Award recognizes those employees who exemplify the iCare values on the job and are serving as role models to others. The actions being recognized should have occurred during the past year. All staff are considered. Nominations can include both clinical and administrative actions towards patients, peers, or the medical center, and should indicate the specific actions or behaviors that demonstrate one or more of the iCare values. Please welcome again Ms. Ruth Hatchwell from the iCare Committee to present these awards.
Our first award is for integrity. Ms. Delco, who is currently deployed, is a highly reliable and dedicated member of the Jerry Vet program, consistently adjusting her schedule to ensure continuous coverage. She conducts numerous Jerry Vet screenings, building strong relationships with veterans and their families, and ensures necessary consultations, durable medical equipment, and bedside supplies are provided. She maintains prosthetic stock in the emergency department, collaborating with other departments to ensure the Jerry Vet program never runs out of supplies, even during her military leaves. Ms. Delco is deeply committed to the VA's mission. She performs thorough chart reviews, identifies unmet needs, and connects veterans with resources from other departments. Her daily callbacks earn significant gratitude from the veterans. During screening, she discusses concerns with providers, providing a whole health approach and asking what matters most to the veterans. She collaborates with the emergency department providers to create comprehensive care plans, leading to home-based primary care consultations, home health aides, and comprehensive geriatric assessments, enhancing continuity of care. She also works to admit veterans to the hospital when home safety is a concern. Her effective communication with other disciplines ensures collaborative veteran-centered care. Notably, she stayed at the bedside of a confused veteran throughout their emergency stay visit, providing crucial support and enabling other nurses to deliver care. Please congratulate Dominique Delco, Intermediate Care Technician in the Jerry Vet program. Our next awardee is for commitment. Brandon Dumont, a third-shift pipe fitter at Cleveland VA Medical Center, is highly recommended for an eye care award for his exceptional commitment and excellence. As a sole third-shift plumber, he adeptly handles numerous trouble calls such as blocked drains, leaking fixtures, steam leaks, and water temperature issues, ensuring a high-quality environment for veteran patients. On October 25, 2024, Mr. Dumont was instrumental in repairing a major water leak that flooded a business unit and main hallway. He proactively completes extensive preventative maintenance and regularly volunteers for extra projects, showcasing remarkable initiative and teamwork. He improved the Hillrom nurse call system by installing a protective data cabinet for remote server, safeguarding electrical critical equipment. He also played a vital role in replacing 192 non-compliant fire alarm system batteries over 3 months, followed by volunteering to correctly identify and label over 2,500 fire alarm notification devices through the medical center. Mr. Dumont's performance consistently exceeds expectations, highlighting his dedication to the VA Medical Center and his commitment to excellence in his role. Please congratulate Brandon Dumont from Engineering. Advocacy. Over the past year, a veteran patient has been showing up on Cleveland VA property because he has nowhere else to go. This individual is homeless and repeatedly committed small violations to an extent that he received multiple citations. Officer Larco, among others, was directly involved with planning to get the patient care to include housing and rehabilitation. Officer Larco took a vested interest in his case and personally contacted the patient, following through with a plan. He worked with 2 outside agencies that assisted with his goal for this veteran and ultimately showing that people should be invested in rather than being written off. Officer Larco's role in the plan was not easy and possibly underappreciated by others, to include the patient. It was his hard work and drive that caused him to continuously try, understand, and work towards the bigger picture where others did not. Please congratulate Officer Edward Larco from Police Services. For respect, Nurse Christina Lane consistently goes the extra mile for homeless veterans, regularly visiting shelters to ensure their needs are met. Recently, she showcased incredible dedication by assisting a veteran struggling to manage a new ostomy after surgery. Without the proper supplies and unable to reach his usual doctor, he worried about returning to the shelter. Nurse Lane intervened, contacted his doctor, and obtained necessary orders and resolved issues with the pharmacy. When immediate supplies became problematic, she created an interim care package and personally drove to the shelter in Sandusky to deliver the items. The veteran was extremely grateful for her swift and thoughtful assistance. Her dedication continued as she followed up with the pharmacy to resolve supply issues and provided shelter staff with other options for backup items. Nurse Lane's commitment made a significant difference in the veteran's recovery and reinforced the mission to support homeless veterans. Her outstanding efforts ensured the veteran received critical care and supplies as he needed them. Please congratulate Kristen Lane, Social Work Services Nursing Team. Excellence. While off duty and attending a local girls' basketball team in his home community of Clyde, Ohio, Nurse Salazar observed a male spectator, who was a parent of one of the players in the game, collapse. Relying on the skills that he sharpened quarterly in the CPR sessions, Nurse Salazar became the sole first responder on the scene and began CPR on the male. He was able to initiate chest compressions as well as to enlist assistance from a bystander that identified herself as a respiratory therapist to obtain AED and monitor breathing. Nurse Salazar was also able to command others to clear the scene by removing all the children participating in the sporting event and activate EMS via 911 dispatch. After several cycles of BLS CPR, the male victim regained consciousness and was placed in the recovery position until EMS arrived on the scene and took over the care. The man was transported to a nearby emergency room for advanced level care and has survived the medical emergency due to the swift actions and application of knowledge by our colleague. Please congratulate Rick Salazar from COPS Telehealth. Our final award is for the iCare Award for Excellence in Serving Leadership. This award is presented to employees in leadership positions who have demonstrated exemplary serving leadership by creating a culture of trust, fostering leadership in others, mentoring, removing barriers to achieve goals, demonstrating humility, global awareness, understanding, and embedding organizational purpose into day-to-day operations and demonstrating the iCare values. Our Q3 2025 Serving Leader awardee is James Holbrook, the Suicide Prevention Program Manager for the past 2 years. He has transformed our team through visionary leadership. He successfully recruited and trained 4 exceptional suicide prevention coordinators, integrating them smoothly into our mission. His remarkable leadership and unwavering support have made the new staff feel welcome and inspired extraordinary results. Mr. Holbrook's expertise, respect, and kindness create an environment that ignites our passion for serving others. He fosters a sense of family, driving us to consistently exceed expectations for veterans, the VA, communities, and each other. His profound compassion shines when team members face personal challenges, encouraging well-being while maintaining staffing levels. He led efforts to promote Risk ID through the medical center, using the CSSRS to quickly identify veterans at risk of suicide, allowing immediate mental health interventions and significantly reduce suicide rates. Under his guidance, we ended the 2024 fiscal year as a VISN 10's top-performing facility, surpassing the national average. Our team has seen increased veteran crisis line calls and high-risk suicide flag identifications for our most vulnerable veterans. Through Mr. Holbrook's problem-solving skills and empowerment, we have consistently met or exceeded nationally mandated standards for VCL response and flag management. He expertly balances our efforts and capabilities, standing by us as a leader, a mentor, and an advocate. Mr. James Holbrook embodies iCare values in every aspect of his leadership, making him truly deserving of this recognition. Please congratulate James Holbrook, Suicide Prevention Coordinator. Thank you, Catherine, for being our MC today for our award ceremony once again. In closing, I would like to congratulate all of our awardees and thank you for your amazing work that you do here at the VA Northeast Ohio Healthcare System. And to those of you who've come to support them, I'd like to thank you for supporting those awardees. Any awardees that were not present today will receive their awards within the next week. And I invite all of you to... Did we miss somebody? Oh, okay. I beg your pardon. I invite all of you to please join us at the back of the hall to celebrate with our awardees. Thank you, everybody, for attending today.